Okay, we're gonna continue with bacterial vaginosis. So this is not considered an STI. It's poorly understood, but they do think there is a correlation between the two. This is usually going to be due to an overgrowth of normal flora or a lack of normal flora, allowing something else to grow that shouldn't be doing there, or due to douching. Assessment: thin grayish white discharge that has a fishy odor to it. Diagnostics: so often you're going to hear like a wet mount with a KOH prep. The KOH prep is to determine if the person has bacterial vaginosis. And then a whiff test is also done to see if there is a fishy odor. There's usually that distinct fishy odor that is done. And then we can look at it under a microscope and see those clue cells there. For treatments, metronidazole is going to be the antibiotic of choice to restore that normal flora balance. And then this medication is contraindicated in the first trimester of pregnancy. STIs, okay, chlamydia and gonorrhea, both of those go hand in hand. It seems like if somebody has a chlamydia infection, they also have gonorrhea, or if they have gonorrhea, they have chlamydia. They almost always will have both of them. So the best prevention against STIs is going to be best prevention is abstinence. And then second best is going to be barrier method of birth control, meaning condoms. Mucous membranes are up for grabs. Eyes, nose, mouth, anus, penis, vagina. Those are all mucous membranes that could be infected with an STI. So chlamydia signs and symptoms: yellowish discharge with painful urination, often going to be asymptomatic. So that's what I've heard. That, well, it's not bothering me. Why do I have to get treatment? Well, because it can cause what I have down here, uterine tube scarring, which leads to infertility problems down the road. So how is this diagnosed? Through culture and then possibly through a urine rapid test. There are certain parameters with the urine rapid test. I think they can't void 2 hours prior to and things like that. The treatment is going to be azithromycin. It's typically a heavy, one dose, maybe two, for the infection. If not taken care of during a pregnancy, it can cause conjunctivitis and pneumonia in a newborn that has passed through the vaginal canal. Gonorrhea signs and symptoms: purulent discharge and painful urination, and then dyspareunia, which is pain during sexual intercourse. This is going to be diagnosed through a culture. Antibiotic, typically going to be a penicillin or a cephalosporin, but need to have a sensitivity done since there's a new resistant strand on the rise. It's coming out of Florida. Florida has a high population of retired and elderly people. So that's where they believe it is coming from. STIs, they are on the rise in the nursing homes. That is a fact. Other considerations: causing blindness in babies. That's why we treat babies with erythromycin ointment in their eyes. And left untreated can also cause that infertility. Syphilis has 3 to 4 stages depending on what resource you're looking at. So I'll just kind of generally go through. But the first stage, or the primary stage, is characterized by painless canker on genitalia, anus, or even around the mouth by the lips. Diagnostics is going to be a scrape of the tissue. Blood test is not going to pick it up at this early stage. Secondary stage, or stage 2, about 2 months after the primary stage, you'll see an enlargement of the spleen and liver. They will complain of a headache, anorexia. The biggest thing is going to be this profuse generalized skin rash. That is going to be characteristic. They may also have wart-like growths on their vulva. Now, that serum blood test is going to pick it up. The later phases, or phase, depending on what resource you're using, what it has is permanent damage to heart, blood vessels, and nervous system. So brain and spinal cord damage are going to be seen with this. For diagnostics, we could still use that serum blood test. Treatment is a very simple penicillin, but that's only effective in the first and second stage. It is not effective after that. Once that damage has set in, it is permanent. It can cause stillbirth and spontaneous abortions, and it is only contagious in the first and second stage. After that, it's not considered contagious anymore. More infections. All right, herpes simplex. So signs and symptoms: clusters of painful vesicles on the vulva, perineum, and anal areas, or anywhere that has been infected. If you get your nose infected, then you're going to have an outbreak on your nose. things like that. So it is all these little vesicles. It's caused by a viral infection. Vesicles rupture in 1 to 7 days and then heal in 12, and they'll have like flare-ups of these. It'll be gone for a while and then it'll come. Diagnostics is going to be a viral culture, which is really hard to get. Viruses tend to die when they get outside the body. And then generally it's just diagnosed by signs and symptoms. Treatment, there is no cure. Medications like acyclovir and valacyclovir may reduce the symptoms, make them shortened. And then sitz baths during pregnancy can help because, well, you can't have those medications when you're pregnant. Other considerations may cause stillbirth or spontaneous abortions. And if mom is pregnant, she will need to deliver by C-section in order to prevent the newborn from being, from the infection being spread to the newborn. And when I have seen that or encountered this, like up at Unity Point, typically if mom does have an infection going on and it's active right now, she's got the symptoms of vesicles, they've taken baby up to NICU just to even monitor and make sure baby's doing okay. Because the initial infection is systemic flu-like symptoms. So that's why they watch those newborn babies really close. HPV, the human papillomavirus. So this is another viral infection that is considered an STD. It is characterized by genital warts or venereal warts. Signs and symptoms are dry, wart-like growths on the vagina, labia, cervix, and perineum. For diagnostics, it's typical in appearance and location. They just look, see where they're at, what they look like, and that's pretty much enough for a diagnosis. They can be tested with a pap smear as well. And treatment is going to be cryotherapy or electrocautery or laser even to try to get those warts removed. Other considerations of vaccination like Gardasil to prevent, and then to take note that HPV can cause cervical cancer. There is correlation studies out there that show that the more sexual partners a patient has, the more likely they will get an HPV infection. And this is, you hear a lot with women just because of the high incidence with cervical cancer, but there is a lot of worry about men out there as well, because they will have the infection if it's being spread by an STI. Trichomoniasis, or just known as trich. This is a type of STI. It signs and symptoms: thin, foul-smelling, greenish yellow vaginal discharge, vulvular itching, edema. To be a antibiotic is going to be metronidazole. And then other considerations, this does not cross the placental barrier. It can be a postpartum infection due to the contamination, but most likely this is due to sexual contact, and it thrives in an alkaline environment. The first time I have seen a trich infection was when I was working in urgent care in Des Moines. We had an 89-year-old female come in with vaginal discharge, so doctor orders a wet mount and a KOH, and it came back as trich, and he said, "Don't do anything with that slide. I gotta come and look at it." Yep, it was trich. So this 89-year-old woman had an STI. And then pelvic inflammatory disease, I've got that last one there. This is any infection in the female reproductive system. Just like the UTI, it can start in the vagina, which is the opening to the world, right? Move up into the uterus, which needs to be a sterile environment, up through the fallopian tubes, also a sterile environment, and into the ovaries, which of course needs to be sterile. It is mostly caused by STIs. Gonorrhea and chlamydia are the most common cause, but it also can be due to an infection during childbirth or miscarriage. Okay, uterine prolapse. So causes is going to be weak pelvic floor muscles. What tends to happen with this is that the uterus just falls right into the vagina or to the side of the vagina, occluding it. So those weakened pelvic floor muscles and ligaments just cannot hold that uterus into place, what puts people at more risk. Having multiple pregnancies or birth to a large baby, or having a multi-gestational pregnancy or a multi-fetal pregnancy, just meaning twins, triplets, things like that, put people at risk. Assessment, the most common report that I have from clients is they feel like their bladder is falling out. I've heard that several times from women. I get, I used to be a phone nurse, so I'd get that call on the phone. I feel like my bladder is falling out, and then, it'll be a uterine prolapse. Pelvic fullness, dragging sensation, pelvic pressure, fatigue, low backache, or backache. And then sometimes that uterus can be pushed back up into the vagina. Consequences can be pain and infection. For treatment, surgical can be repair with a device or an implant to hold the uterus in place, which is contraindicated with pelvic inflammatory disease or latex allergy. Another treatment is going to be just to do that total hysterectomy if it keeps falling out and keeps making problems. A preventative is considered Kegels, which is a way to strengthen those pelvic floor muscles. We tell women to, when they're voiding, to stop the flow of urine, and that will give you the sense of what muscles you need to be working with Kegels, and it should be 5 cycles of 10 reps every day. Okay, there's a picture there of normal uterus and then a uterus that has descended into the vagina. Okay, cystocele and rectal seal. So when we talk about these seals, it means that it's kind of running into some other type of tissue. So this is the bladder falling into the vaginal wall due to those weakened pelvic floor muscles. And it's the same with the rectum. The rectum's falling into the vaginal wall due to those weakened pelvic floor muscles. Assessment finding, typically with cystocele, is going to be stress incontinence. So with that abdominal pressure, a little bit of urine is going to leak. That's the one, like sneezing, coughing, laughing, things like that. Consequences are going to be UTI and urine retention. Surgical treatments will include a mesh that is placed to hold the bladder in its correct position, or Kegels in order to strengthen those muscles. Rectocele, so like I said, this is the rectum falling into the vagina. So feces actually starts pushing the rectum there, and because of those weakened pelvic floor muscles, it can't hold it into place. It can be difficult to evacuate feces and feel pain and pressure with defecation. Consequences can be constipation, that it just keeps building and not leaving. Nursing treatments and intervention. I have never had to do this, but I suppose, if you ever encounter this, you're going to have to know how to handle this. It is inserting fingers into the vagina and placing vaginal pressure on that rectal wall, on that posterior vaginal wall, so to straighten that rectum back out in order for feces to move on out. Another prevention, obviously, Kegels. Hey, there's the bigger picture. So bladder falling into the vaginal wall, and rectum falling into the posterior vaginal wall. Okay, I'm actually going to stop there and continue this with another recording.